come in.
Good morning, Dr. Ullman. My name is Danielle Ullman, and I'm going to be the nurse practitioner conducting your physical exam today. Today, we're going to be focusing on the neurological and the musculoskeletal exam. If you have any questions when we're going along, you just let me know, okay?
Okay.
So we're going to start with doing the cranial nerves. We'll
Okay.
start with nerve 1, which is olfactory. I'll have you close your eyes, and then I'm going to put a smell under your nose. Can you tell me what you think that is?
Listerine?
Yes, good job. So that is intact. Next, you can open your eyes for me. We're going to text 2, which is optic. Can you cover one of your eyes and read the lowest line you can for me?
Yep. 937826.
Good.
And 428739.
Perfect. Okay. And then next we're going to move on to test your oculomotor, trochlear, and abducens. Those are all going to be tested. You're just going to follow my finger, and we'll do them all at the same time, okay? Good. And those are also intact. Next we're going to move on to the trigeminal nerve. So I have 2 different sensations. So this one is going to be soft, and this one is going to be sharp, okay?
Okay.
I'm going to have you close your eyes. I'll touch different spots on your face. You'll tell me if it's sharp or dull.
Eyes are closed. Soft. Sharp. Soft. Soft. Sharp. Soft.
Good. Okay. And then next, I'm going to have you can open your eyes for me. I'm just going to have you clench your jaw. Good. Okay. And that is the motor portion. I feel the muscle tense, meaning that it is also intact. Next, we're going to move on to the facial nerve. So I'm going to have you start by closing your eyes as tight as you can. Good. And don't let me open them. Good. Okay, next, I'm going to have you smile for me real big and show your teeth. Perfect. And then can you puff out your cheeks for me? Great. Okay. So that is also intact. Next, we're going to move on and test your vestibulocochlear, so your hearing. So I'm going to have you close your eyes. I'm going to rub my fingers together, and you'll tell me which side you hear it on, okay?
Right. Left. Both?
Yep. Perfect. And then we're just going to do a couple tests with the tuning fork. Can you tell me which side do you hear it more on?
It's equal.
Perfect. And now I'm going to tap the tuning fork again, put it on your mastoid, and then as soon as you can't hear it anymore through the bone, I'm going to put it to your ear, and you'll tell me if you can hear it or not, okay?
Can't hear it anymore. Oh, can hear it.
Okay, good. One more time on this side.
Can't hear it. Can hear it.
Vestibulocochlear is also intact. Next, we're going to move on to glossopharyngeal and vagus. We'll test those together. If you could open your mouth for me and say ah. Perfect. And I'm seeing symmetric movement of the palate, no deviation of the uvula, which is normal. And then I could also do the gag reflex at this time, but we will defer that. Next, we'll be testing spinal accessory. Can you shrug up against my resistance? Try to move your shoulders up. Good. Okay, now I'm going to put my hand here. You try to turn your head against my hand. To the side. Yep, like that. There you go.
Sorry.
You're okay. And then do the same on this side. Perfect. Spinal accessory is also intact. And then finally, we'll do hypoglossal. Can you stick out your tongue for me? Good. Move it side to side. Perfect. That is also intact. Next, we're going to move on to the cerebellar function and proprioception. So we're going to do the rapid alternating movements. I'm going to have you place your hands on your thighs, and then you're going to move your hands back and forth like this as fast as you can for me, okay? Perfect. Intact, with a normal rhythm. Next, I'm going to have you stand up with your feet together for me. We're going to start with your eyes open. Good, and I'm not seeing any movement. You're able to stand still and steady. Okay, now I'm going to have you close your eyes and just keep doing the same thing for me. Perfect. I'm not seeing any movement, normal. So now I'm going to observe your gait. So if you could walk for me, you can walk towards or away from me, either way is fine. Perfect. And now I'm going to have you turn around and walk on your toes. Good. Then walk back for me on your heels. Good. And then finally, I want you to walk away and walk heel to toe. Put your heel right in front of your other toe on your other foot. Perfect. Perfect. And you can sit back down for me. And the gait appears normal. Normal rhythm. Our movements are normal. I'm not seeing any problems with your balance. Next, we're going to test your sensory response to superficial touch and pain. So I'm going to have you lay down on the bed for me. We're going to be using those same two, sharp, dull, and I'm just going to touch random spots on your body, and you can tell me where you feel them, okay? If it's sharp or dull.
Dull, right arm. Dull, left forearm. Sharp, left thigh. Dull, right abdomen. Sharp, right lower leg. Can you do that one again? That was dull, left foot.
Okay.
Sharp, right foot. Soft forehead.
Good. All right, sensation is intact. Now I'm going to do the position sense of your toe and your finger on each side, okay? So I'm going to have you close your eyes while we're doing this.
Okay.
This is up, this is neutral, this is down. I want you to tell me the position I put your toe in, okay?
Okay. Up. Down.
Good. Same on this side. This is up, this is neutral, this is down.
Okay. Down. Neutral.
Good. Okay, next we're going to do the same thing. I'm going to do it with your hands though.
Okay.
All right. So up, neutral, down.
Okay. Neutral. Down.
Good. And then can I see this other side? We'll do one over here as well. So up, neutral, down. Okay?
Okay. Up. Down.
Good. Perfect. So your position sense is also intact. Next, I'm going to place an object in your hand, and I want you to tell me what you think the object is.
Paperclip.
Perfect. And then next, we're going to do the 2-point discrimination. So you're going to tell me if I'm touching you with 1 or 2.
Feels like 1.
Okay. How about now?
2.
Good. Can I see that other hand?
2.
Good. Okay. 2-point discrimination is intact. And then next, I'm going to just touch areas of your body with my hands, and you just tell me where you're feeling me, okay?
Okay. Right arm. Left chest abdomen area. Left lower leg. Right foot and ankle. Right neck.
Good. Okay. So your ability to identify body areas are also intact. Next, we're going to move on to some reflexes. I'm going to start by doing your abdomen. You're going to feel a sharp sensation on your abdomen. I just want you to relax for me, okay? Good. And your abdomen does contract when I apply the sharp force, which is normal. Next, we're going to move on to your plantar reflex. I'm going to do a Babinski. You're just going to feel me touch on the bottom of your feet with the bottom of my reflex hammer. Good. Good. And the big toes do curl downward, which is normal. Next, we're going to move on to some more reflexes. So I'll have you sit up for me and face forward again. Excuse me. All right. So we're going to start with your biceps reflexes. And then we're going to do brachioradialis. Good. Yeah, position that hand like that. Good. Okay, and then we're going to do triceps. I want you to give me all the way to your arm. Okay. the same on this side. Okay. And then we're going to move on and do your patellar. Let me see if we can angle this down. Okay. All right, and then I'll do your Achilles reflex. You won't be able to see that one, but I will be striking the back of his Achilles tendon and holding his foot up, supporting it with my hand. Perfect. And then the other side. Good. All right, and now I'm going to check the angle for clonus. I'm doing that by rotating the ankle and then applying upward force. And no clonus is present. All right, and next we're going to move on to the musculoskeletal exam. So I'm going to start by inspecting and palpating the musculoskeletal system. So I'm just looking at your overall muscular structure, your extremities. I'm comparing sides. Your alignment looks normal. I'm not seeing muscles bigger on one side than the other side. Everything's symmetric. I'm not seeing any size or deformities that are abnormal. Skin looks normal. I'm not seeing any areas of discoloration. Joints, I'm not seeing any abnormal coloring. I'm not seeing any swelling or masses visible. Next, I'm going to move on to inspecting your muscles. I'm going to palpate them, looking at the size, symmetry, seeing if there's any fasciculations. Is there any pain when I'm touching you?
Nope.
Okay. Any pain over here?
Nope.
Okay. Any pain down here in your legs?
No.
Okay. And any pain in your neck?
No.
Your shoulders? Okay. All right. And then, so everything, you are warm, muscle tone is normal. I'm not seeing any swelling. Not feeling any crepitus as I'm palpating. Next, we're going to move on to test your active and passive range of motions of your muscular groups, and then at the same time we're doing that with those muscular groups, we're also going to check the strength of those groups and compare the sides, okay?
Okay.
So we're going to start with your hands and wrists. So first, I'm just going to move your fingers. Is there any pain when I'm moving your fingers at all?
Nope.
Any pain when I'm separating them?
Nope.
Okay. And then I'm just going to move your wrists. Any pain with that?
Nope.
Okay. All right. So now I'm going to have you move your wrists for me. Can you rotate your wrists? Good. Spin the other way. Good. Can you extend your hands out, separate your fingers, bring them together? Perfect. All right. Keep them together. Don't let me pull them apart. Don't let me pull them apart. Good. And now put them apart. Don't let me bring them together. Good. All right. And now I want you to take your wrists and I want you to try to push up on my hand. My hand's going to try to push you down. Good. Same with this one. Push up. Good. All right. And now I want you to push down. Don't let me pull you up. Okay. Good. Okay. Wrists are strong. And then can you just squeeze my fingers with your hands? Perfect. All right. Strength is normal, equal on both sides. Next, we're going to move on to the elbows. So, extension, flexion, any pain with that?
No.
Extension, flexion, any pain?
Nope.
Can you do that for me as well? Perfect. All right. Now, I'm going to have you try to bring your arms up towards you. I'm going to push you down. Good. All right. And now, try to bring them down. Good job. Strength is normal in the elbows as well. Next, we're going to move on to the shoulder. I'm just going to passively move your shoulder first. You let me know if there's any pain as I'm doing any of this, okay? Any pain with any of that?
No.
Okay. Any pain with any of this?
Nope.
All right. Now I'm going to have you move your shoulder as well. So I want you to start, bring them up. Good, and bring them down. Put them behind your back. Can you put them behind your neck like this as well? Okay. Any pain with any of that motion?
No.
Okay. All right. Next, I'm gonna have you raise your arm out to the side. Good, as far as you can. And then I want you to slowly lower it down. Good. And you can stop right there. You do it on the other side as well. Sorry. Good. Good. He's able to smoothly lower his arm, which you wouldn't be able to do if you had a rotator cuff tear, which is good. All right, so now I'm going to have you try to lift your arms, and I'm going to try to push them down. Does this hurt at all? Okay, and now I'm going to try to hold them up, you push down. Perfect. Okay, no pain with that? Okay, so good strength in your shoulders. Next, we're moving on to the temporomandibular joint. I'm going to have you clench your mouth for me. Good. Now, don't let me pull it open. Good. Now, open your mouth. Good. Don't let me close it. Perfect. And that is strong and intact. Next, we're going to move on to the cervical spine. So I'm going to have you move your neck. Put your neck down. Good towards your chest. Now bring it back. All right, side and another side. Perfect. Any pain with that motion? Okay. Now I'm going to try to have you put your neck down. I'm going to try to push it back up. Good. Okay. Same on this side. Good. Okay. Neck is strong. Not seeing any deficits there. Next, we're going to move on to the thoracic and lumbar spine. So if you could stand up and face away from me. All right. So I'm looking at the curve of his spine, which is normal. I'm going to have him bend forward towards the ground. Is there any pain with that movement?
Nope, hamstrings are tight.
Any pain where I'm touching?
Nope.
And I'm not feeling any step-offs or anything? Any pain right here in your hips?
Nope.
Okay, perfect. You can stand back up for me. Good, and you can sit back down. All right, so thoracic, lumbar spine, not seeing any abnormalities there either. Now you can go ahead and lay back. Okay, so now we're going to check your hips. First, I'm just going to passively move your hip. Let me know if there's any pain with any of these movements. Good. Okay, and then can you roll over onto your stomach for me for a second? Good. Just extending your hip. Any pain with that?
No.
Okay, can you lift up your hips for me one at a time? Good. Perfect. You can go back onto your stomach. Okay, and now I want you to move your hips for me in the same motions that I was having you do. So lift your leg up. Good. Now out to the side, cross. Good. And back down. And same with that other side. Perfect. All right, and now I want you to try to lift this leg up off the bed. Good. Don't let me push it down. Good job. Perfect. Okay. Now this leg, same thing. Good. Okay. And now that this one, put it back in the air. Now you try to push it down. Good. Okay. And try to push this one down. Good. Okay. Now we're going to move on to that knee. So I'm just going to bend. Okay. Any pain with that?
Mm-mm.
Okay. All right. And then we're going to move on to the feet and ankles. So I'm just going to start by moving your ankle. Any pain with that?
No.
Any pain in your toes where I'm pressing?
No.
Okay. Any pain here?
Mm-mm.
Okay. All right. Okay, so now I'm going to have you rotate your ankles. Good. Can you press down for me? Good. Okay, pull your feet up towards the sky. Good. Okay, and then just, can you bend your toes for me? Good. And don't let me pull them apart. Yeah. Good. Don't let me pull them up. Okay. And then straighten. Don't let me push them down. Okay, good. Okay. So, knees, feet, ankles, all intact, normal strength. Not seeing any issues there. And then finally, I'm just looking at your ankles and feet, looking at the alignment. They're aligned with the tibia, size normal, toes normal, not seeing any abnormalities there. And I'm just going to have you stand up for me. And again, I'm looking for the same things, the alignment with your tibias, the toes, any bowing in the legs, anything like that. Everything appears to be normal at this time. All right, and with that, I think we're done with the exam. Do you have any questions for me?
Nope.
All right. Thank you, Dr. Ullman. It was great to meet you.